I'm going to start off with Nasopharyngeal suctioning. We did not get a kit for this at all, so I'm going to work with other supplies that I have. So first you would walk in, wash your hands, introduce yourself to the patient, ask for their name, date of birth, and see their ID band. Then you would clean off their bedside table, gather your supplies, let them know, again, what you're doing, and how it'll help them breathe better, put them into semi-Fowler's position, and then you'd put a waterproof pad over them, and turn on the suction and make sure it's working. And then you would open up your sterile packaging, which comes with sterile gloves, a little fold open box. You would have saline solution, lubrication, the tubing, and then you would wear proper PPE, which would be like a mask, a splash guard. You could wear the gown. And then you would start off by hyperoxygenating the patient. And then you'd put on you would add your sterile solution into the little box, and then pour out some lubrication, and then you would put on your sterile gloves, open up the like, not catheter, the tubing, and you would use your dominant hand as your sterile hand and your non-dominant as your clean hand. And first you would take the end with your sterile hand, this would be gloved, and you're gonna use your left hand, my non-dominant hand, as the one to do the suction, which this would be like that. This would be connected to the suction on the wall. And then first you're going to dip it into the box with the saline solution to make sure the suction is working. And then you are going to, with your sterile hand, put it into the patient's nostril and feed it in about, my teacher said, like 5 seconds, making sure that your fingers do not touch the tip of their nose. And obviously you would have taken off their mask for hyperoxygenation. So as soon as you pull this out, and you're suctioning on the way out, not the way in, you would hold it, making sure not to get anything. This would stay sterile, and then oxygenating them, putting this into the box with the saline solution and suction to get everything cleared out of the tubing. And if they need it again, you would go in again, but you can't go in more than 3 times. And pulling out with the suction, you can't suction for more than 10 seconds. And then you would just document the procedure and clean everything up.